Welcome to Concept in Medicine. In today's tutorial, we are going to be looking at the sickle cell crisis. How then do you remember the sickle cell crisis? Remember easily using VASH. With that, we are talking about vasoocclusive, aplastic, sequestration, and hemolytic. Let's move ahead and look at the crisis. We'll start with the vasoocclusive. So first thing you have to know is that the vasoocclusive is the most common crisis in sickle cell disease. And you should know that in vasoocclusive, the red blood cells lose their zeta potential, leading to them be able to stick to each other and form clumps of blood, occluding the blood vessel. That's why we call it vasoocclusive crisis. The presentation, they will present with bone pain, joint pain, chest pain. Then with complications, we are looking at acute chest syndrome, which is characterized by dyspnea, that's shortness of breath, and chest pain. And with the diagnosis, you will have to request a chest x-ray. And what will be the finding? The presence of a new pulmonary infiltrate or opacity in the upper lobes of the lungs, plus at least one new clinical symptom or sign. Other complications: priapism, acute kidney injury, avascular necrosis of the femoral head, the pulmonary hypertension, stroke, sickle cell induced retinopathy, and finally medial malleolar ulcers. That would do for the vasoocclusive crisis. Let's move ahead and look at the aplastic crisis. For the aplastic crisis, they are caused due to the infection of the erythropoietic stem cells by parvovirus B19. With that, let's look at how we can distinguish between aplastic crisis and aplastic anemia, since sometimes they may be falsely used interchangeably, but they are different. With aplastic crisis, as we initially said, they are due to the infection of the erythropoietic stem cells by parvovirus B19. What of the aplastic anemia? Aplastic anemia is due to the fatty transformation of the bone marrow. Then again, you should know that aplastic crisis is self-limiting, meaning it resolves usually within 2 weeks, specifically 7 to 10 days. What of the aplastic anemia? For aplastic anemia, it can only be treated with bone marrow transplantation. Then again, for the aplastic crisis, it is characterized by anemia. And since we said it is self-limiting, when it resolves, it is quickly followed by reticulocytosis. What of the aplastic anemia? For aplastic anemia, is characterized by pancytopenia, that is anemia, leukopenia, and thrombocytopenia. With the aplastic crisis presentation, they will come with the symptoms of anemia because the erythropoietic stem cells are not being transiently in function, so they tend to lose that capability of the proportion of the red blood cells. So with that, yes, they will have symptoms of anemia. The complications, we are looking at a severe anemia which may progress into congestive cardiac failure. We can also think of severe bone marrow necrosis, and finally cerebrovascular accidents. The next thing we'll be talking about is the sequestration crisis, and finally the hemolytic crisis. All right, let's move ahead and look at the sequestration crisis. For the sequestration crisis in sickle cell, the red blood cell, the half-life has been decreased extensively to 10 to 20 days. As a result of that, there is increased distraction of the red blood cells, leading to the pooling of these destroyed red blood cells in the spleen. And with that, this usually causes the spleen to become overwhelmed. And as a result of that, there is decreased blood supply to the spleen itself, leading to a process we call octosplenectomy. And when that happens, it predisposes the patient to all sorts of infections, and also there will be a lot of red blood cells being carried out of circulation, causing anemia. So with that, they will present with symptoms of anemia. Then again, with the complications, again anemia will be there. Then again, osteomyelitis coming from the point of infections. And for the osteomyelitis, the organisms involved, when you look at the adult and the children, they are different. With the adult, you have Salmonella, and with the children, you have Staphylococcus aureus. Let's now talk finally about the hemolytic crisis. With the hemolytic crisis, as we said, in sickle cell, the shape of the hemoglobin becomes what? Sickled. You see the sickle hemoglobin giving the red blood cell a sickle shape. As a result of the sickle shape of the red blood cell, there is loss of the surface area for oxygen binding. And as a result, oxygen binding and carriage becomes increasingly decreased. And when that happens, it causes tissue hypoperfusion and cellular hypoxia. The resultant effect is that the red blood cells would tend to hemolyze under oxidative stress, which is now increased. And that is what we call hemolytic crisis. That is how the hemolytic crisis comes about. And for hemolytic crisis, they will present with symptoms of anemia as well. What are the complications of the hemolytic crisis? One, there will be intravascular hemolysis, since the red blood cells will be hemolyzing under high oxidative stress due to the reduced oxygen carrying capacity of the sickle red blood cells. Then also anemia, and finally cholelithasis would be considered as complications of the hemolytic crisis. I believe we've learned something interesting today. Kindly make sure to subscribe, like, share, and also comment the next concept you would like to see in my next tutorial session. My name is Dr. Del, and this is Concept in Medicine. Bye-bye.